My guest at this time is Grace Marie Turner. She is president of the Galen Institute, one of the most respected healthcare policy organizations in the country. We're coming off of two primetime debates from 20 of the now 25 Democratic presidential candidates, and healthcare was certainly a major topic in both of those forums. And we want to get Grace Marie's analysis of some of the major themes that have been emerging from the healthcare conversations on those debate stages. And Grace Marie, thanks so much for being with us.
Always a pleasure, Greg. Thank you.
Well, let's start with the public option. This, of course, for those who remember the 2009-2010 debate with Obamacare, know that this was the most liberal part of the plan at that time. Now it seems like it's the moderate plan from Democratic candidates because you've got Bernie Sanders and Elizabeth Warren and some others who are pushing Medicare for all, essentially single payer, where the government runs everything. So before we get to the numbers on public option, what do you make of the fact that that's moved to the middle or even the right of the Democratic Party?
Yeah, you're right, exactly, Greg. It's become the fallback position when before that was they couldn't even get the public option in Obamacare. That was what they wanted to get in when they passed the Affordable Care Act in 2010, and it was too extreme to get 60 votes in the Senate. So they fell back to the privately run or the private co-ops, which all have failed. But the public option is now, I think, the fallback for Medicare for all. There clearly is a difference of opinion among even Democrats of whether or not they can go as far as eliminating all private health insurance and putting every expenditure in the health sector, 1/6 of our economy, on the federal budget, or whether or not they're just going to say, well, let's just create a new government-run health insurance company to compete with all the private and nonprofit companies out there. We all know that what's going to happen is that they'll put them out of business. You can't have a taxpayer-funded entity with basically unlimited calls on federal resources competing with a private company that has to make a profit, has to show a return to shareholders if they're a public corporation. They would be put out of business. So it's perhaps a slightly slower path to Medicare for all, single-payer health care, but it's absolutely the path.
So there's no middle ground here. If, in fact, the United States were to pursue a public option, eventually it would inevitably lead to single-payer, you're saying.
And I think whatever remains of the health insurance companies as we know them today would become basically public utilities where they would be paid a certain fee for processing the bills and maybe doing some due diligence in how the money is being spent in our health sector. So it absolutely is, it's a path to a much bigger role for government. Mark Pauly, who's one of the preeminent health policy experts in the country with the Wharton School of the University of Pennsylvania, has just done a recent study for the American Enterprise Institute on the role of the federal government today in our health sector. And he says that 80% of all spending in our health sector today is affected and impacted by the federal government, whether it's programs they directly run, like Medicare, where they have a big role in running, like Medicaid, the Veterans Health Administration, where they actually own the facilities and employ the doctors, or the private health insurance that most of us get through our employer, through the big tax break that is given, and therefore the rules they can establish around that. So we're already way down the road to the government controlling 80% of our health sector today. The public option, or even Medicare buy-in, I think, would send us over the edge. And the kinds of things that President Trump has been doing to try to energize the private sector, to actually give consumers more choice and control, I think are essentially important in being able to both stop this encroachment of ever larger government role in our health sector, which, by the way, is causing most of the problems that we're experiencing, or whether or not we can truly go back to a system, actually not back, but forward to a system in which consumers and doctors have more control over healthcare choices in a much more competitive environment where they have a lot more options than they do today, and where there is real discipline in the system to get costs and expenditures down.
We're talking with Grace Marie Turner of the Galen Institute. And Grace Marie, you and I were talking, of course, back during the original Obamacare debate, and there was some interesting shifting of language and so forth to make the Congressional Budget Office estimate look better before that was ultimately voted on. And there was a lot of concern, and I think most of it has come true, about the cost to taxpayers of things like Medicaid expansion and subsidies for those who are actually on the exchanges in the near term before, as you say, this single payer, or rather a public option could lead to single payer. How much of an extra burden would there be on taxpayers to fund this? What kind of price tag would we be looking at?
The most credible estimate that I've seen is by a professor from the George Mason University Mercatus Center named Chuck Blayhouse, who has estimated that the most conservative cost of Medicare for All would be $32 trillion in additional federal spending 10 years. Could be as high as 38 or more. And that's assuming doctors and hospitals are going to be paid significantly less than they are today. They want to be paid at Medicare rates, which are 30 to 40% less than private insurance. One of the Democratic candidates actually said in the debate on Wednesday night that this would put all of the rural hospitals in his district out of business. So even assuming that federal spending goes up by only $32 trillion over 10 years means that doctors of hospitals are going to be paid so little that most of them are not going to be able to keep their doors open. So it's unrealistic, even at the numbers that we're hearing now, to assume that we would be able to maintain the kind of quality and access to health care that we have today. And we see where this goes. In Canada, for example, people wait 20 weeks just to see a specialist before they can begin to have the hope and the promise of getting a surgery or a cancer treatment or even a diagnostic test that we need. Waiting lines would instantly begin. The level of innovation, the level of quality, the access that we expect in this country would absolutely collapse. And I think people who are saying, well, but it'll all be free, well, yes, it's going to be free, but you're going to pay a very high price for that.
Grace Marie, one other issue we want to get your thoughts on before we part ways here, and that is that on Thursday night, in the second round of the Democratic presidential debate in Miami, the question was, would you favor government-sponsored health care for folks in the country illegally? In other words, free to them. All 10 hands went up. What would be the impact of pursuing such a policy?
Well, we're going to find out because California is about to do it, basically saying that we're going to provide care to anybody who shows up. We've been doing that, Greg, for 30 years anyway, through EMTALA, which basically says that a 1984 law that says that anybody who shows up at a hospital emergency room needing care must be treated then and there or transferred to somewhere where they can get treatment. And then there's a large billions of dollars that flow through the system to compensate them for what they call uncompensated care. So we're already doing that today. But just can you imagine the problems we're going to have at the border if we're basically saying, come on in because you're going to get free health care now? And, of course, most of them are going to be coming in with very low, if not zero income, and they'd qualify for any subsidy that the federal government would be able to provide them. And I'm thinking, can we take care of our own citizens first before we decide to invite millions, tens of millions of illegal immigrants and give them a huge new incentive to come into this country for free health care?
Grace Marie, the debate has just begun. Much more to come on both sides of the aisle. We'll be watching, and I'm sure we'll be talking about it. Thanks for your time today.
Thanks so much, Greg.
Grace Marie Turner, president of the Galen Institute. I'm Greg Columbus reporting for Radio America.